Good evening, good evening, good evening. Hey, I see the heart going. Happy Wednesday night. I am a Leslie Wright, and I am your hostess with the mostest. We are talking everything we can talk about eye health and eyesight, how to restore both, either or both. I was able to restore both using natural ingredients, DMSO and castor oil. Hang on a second. Huh. Okay. Anyway, I'm live on YouTube. Hey, YouTube. Live on TikTok. Hey, TikTok. So, everybody, I was not here last night. I wasn't on live last night. I do a class on Tuesdays at 8 o'clock, and I try and bounce early enough to get on live by 9 o'clock. It ran late last night, so I was not able to come on live, but I am here now. This circle up here is supposed to be like a little dual window. I don't know how to make it go away, but it does. It tends to go away when ever I'm on. Pink Room, how you doing? Beef to Beauty Tallow, how are you doing? Thank you for coming. Thank you for coming. Dana, how are you doing? I'm trying to figure out why my tapping on the screen is not working. Dana, come on up. All right, Dana's going to be in the background. Excellent, marvelous, excellent. I'm looking for any comments so far. I got to change my what do they call it? My little welcome message. I got to change that. All right, Dana's going to be in the background for a bit. I said hello, hello, hello to everyone. Coco's here. Hey, Coco, how are you doing? Hey, how's it going?
All right. How you doing?
I'm great. I believe I just spoke with you moments ago. She's in the background.
I'm good. How are you? Oh, she's resting her mic off. Okay.
Yeah, she's in the background. Okay. So, Coco, you sent me a message that somebody left on my TikTok.
Yes.
And so I went into ChatGPT. Where was it? Come here. Okay. I went into ChatGPT and asked about it because I have not heard this acronym before, PCO. And that's exactly what the individual was asking about. So I wanted to just give you an update and everybody else an update of PCO. So I asked ChatGPT, what is PCO eye disease? And PCO stands for posterior capsule opacification. I was trying to figure out how to say that word correctly. Opacification. It's a condition that can occur after cataract surgery. Now, you've had cataract surgery, you've had your natural lens obliterated and removed, and you now have an IOL, an interocular lens, that is a replacement. It's a non-human lens. So when cataracts are removed, the natural lens of the eye is replaced with an artificial interocular lens, IOL. The posterior capsule, a part of the eye that holds the artificial lens in place, is left intact during surgery. Over time, cells may grow on this capsule, causing it to become cloudy, which can result in blurred or diminished vision. This is often referred to as a secondary cataract, though it is not technically a cataract. So, when the symptoms of PCO are blurry vision, glare, especially from lights, difficulty seeing in bright conditions, decreased contrast and sensitivity. The treatment is PCO is typically treated with a YAG laser capsulotomy, a quick outpatient procedure where a laser creates a small opening in the clouded capsule, restoring clear vision. The procedure is safe and effective with minimal recovery time. So, they take the cloudy lens out of the eye, they replace it with an artificial lens, and the capsule that the lens sits in can also become opaque. And the way to solve that is to actually cut a hole in the capsule so that light can travel through to the lens properly and you can then see clearly. That to me is just weird. The thing that's interesting about this,
I was thinking the same thing. I'm like, they can do that.
right? The thing that's interesting to me um, is the way that it's worded in ChatGPT. So I've got to ask the next best question. So uh, it actually says, over time, cells may grow on this capsule. So what does that mean? What kind of cells? We know that protein buildup is what's on the lens of the eye, but that protein buildup attaches to the natural lens. Apparently, it doesn't attach to the artificial lens. But what's attaching itself to the capsule?
I'm not sure.
Yeah, no, I'm asking that question now. Like, what type of cells attach to the capsule?
Right.
Okay, so it says the cells attached to the posterior capsule and cause posterior capsule uh, opacification are primarily lens epithelial cells. So this is like sloughed off skin. Process of PCO development, residual lens epithelial cells during cataract surgery. Most of the natural lens is removed, but some lens epithelial cells may remain on the capsule. Cell migration and proliferation. These remaining cells migrate, grow, and spread across the capsule. Fibrosis and opacification. Fibrotic PCO. Some lens epithelial cells differentiate into fibrosis or fibroblasts, producing collagen and causing the capsule to thicken and contract. Pearl type PCO. Some cells transform into a more rounded balloon like shape called Elskins pearls, further clouding the capsule. These cellular changes lead to the clouding of the capsule, which can interfere with the passage of light and degrade vision. So there is PCO, which is the diagnosis, but there's 3 different types of PCO. Yeah.
Girl, my mouth is just open. I don't know. So it's considered a secondary cataract. Then you
Yeah.
have to have another surgery to cut. I think you said the capsule or something within the eye.
Yeah, they're cutting an area in the capsule so that light can pass through.
So you can see.
So you can see. Yeah.
But what other issues can result in that though? Because that sounds like I don't know.
Well, I'm asking the next best question. I want to know, because ChatGPT is saying there's 3 different types. So how do you know which type? So it says determining the type of posterior capsule opacification you have involves an eye examination conducted by an ophthalmologist. And here's how they assess it. Your doctor will ask you about your visual problems, such as blurry or cloudy vision, glare, halos around lights, difficulty reading or seeing in bright light. All of the things that are issues with cataract. So, and then they do a slit lamp examination using a slit lamp microscope. The ophthalmologist examines the back of your eye, including the posterior capsule. So, fibrotic PCO.
You have cataract, you get cataract surgery just to have cataract.
Yeah, exactly. Fibrotic PCO, the capsule appears thickened or wrinkled due to fibrous tissue formation. Pearl type PCO, the doctor may see shiny pearl-like clusters of epithelial cells. So, and visual acuity and imaging tests. So, if needed, additional tests like retinal imaging or visual acuity tests can confirm the impact of the opacification on your vision. Why knowing the type matters. The type of PCO doesn't usually change the treatment, a YAG laser capsulotomy, but understanding the nature of the opacification can provide insight into the progression and help with personalized care. If you suspect PCO, scheduling an eye exam is essential. Okay, so what issues arise hang on a second.
And remember, she said she also had a retina disease, so I don't know if there's some causation or correlation to that.
Well, and she could have retinitis pigmentosa, which is hereditary. There's all kinds of things that could be. This is one of the problems with leaving messages like that on TikTok on the DM, because the way that I think I need to know the answer to the next logical question, because those next things dictate what I think may be beneficial.
Right.
So then I asked, what issues arise from the YAG laser treatment? So YAG laser capsulotomy, while generally safe and effective for treating posterior capsules opacification, can occasionally lead to complications. Here are the potential issues. So rise in interocular pressure. So what happens, a temporary increase in eye pressure can occur immediately after the procedure. Doctors may prescribe eye drops to control the interocular pressure before or after the treatment. Retinal detachment, so you can have a retinal detachment. Macular edema, so that's swelling in the macula. Damage to the interocular lens, so what happens, the laser may accidentally damage or displace the artificial lens. This is rare, but in severe cases, lens replacement might be necessary, so you might have to have an additional surgery. And persistent floaters. So debris from the procedure may cause floaters, which can be bothersome but usually diminish over time. And then there's a recurrence of symptoms. What happens is sometimes other parts of the capsule may cloud over later, although this is rare, after a successful capsulotomy. and then infection or inflammation. And so, and the important notes are risk level, complications are rare. The most people experience significant improvement in vision after the procedure. Follow up, always attend follow up appointments to monitor for potential issues and emergency symptoms. If you experience severe pain, vision loss, or other unusual symptoms after treatment, contact your ophthalmologist immediately. So, all of that is an after occurrence from the actual cataract surgery.
Right. That's scary.
It can't. Yeah, it's scary. It just is.
And that was after what? Basically 2 or 3 procedures?
Well, you might have to have up to 3 procedures to fix the leftovers from the first procedure. And the first procedure, the epithelial cells that are left from the removal of the lens, of the natural lens to begin with, is what actually causes the cell growth, the epithelial cell growth that causes the opacification of the capsule. So there's a lot in there. That's not an easy answer in any way, shape, or form. It's not an easy answer.
Right. I'm gonna have them. Well, that really requires a call because it just sounds like there's so many questions that are unanswered.
Yeah, and the first question I have is, why hasn't your current doctor already suggested the YAG? Why haven't they suggested the YAG surgery to, open up the capsule so that you can actually have better eyesight?
Right. Okay. I'll reach out to her and see if we can get a better understanding.
No, 100%.
Can't think of cool name yet. Stated, what can I do about ulcer scar? Do you have any advice? For one, I love the name.
So do I. I said the same thing. I said I should have thought of that. Can't think of a cool name. Hello, this is Leslie.
Hey, I am so sorry to bother you. Is this a bad time?
I'm on live on TikTok and YouTube right now.
Oh, okay. Okay, well, can I just call you later then?
Sure. I'm off live at 11 p.m.
Okay, thank you.
Okay, no problem. Bye-bye. Okay. So, can't think of a cool name yet. Where is the ulcer scar? That's what I'd like to know. Is this an ulcer in the eye? Where's the ulcer scar? That is a great name, though. I love it.
It's in the front of my eye.
Okay, it's in the front of your eye. So, yes. And can I ask how it got there? Was it like an infection? Was it something that happened naturally? Was it trauma? Are you there? All right. Can't think of a cool name. I can't hear you. I don't know if you're connected or not.
Hello, testing.
Yes, yeah, I hear you now.
Sorry about that.
So, can you tell me how the ulcer got there? I wanted to know if it was trauma, an infection.
Yeah, I had my contacts on for a couple of days, and when I took my contacts out, and then it created the ulcer scar.
Okay. And okay, are you still wearing contacts?
No, I haven't worn contacts in about 2 weeks. I've been doing drops every couple of hours, and I went to a optometrist, and they gave me some steroids to take orally, and then they also gave me Trobermin steroid drops and a cream. I've been off all of the medication for like the last 3 weeks, but I noticed there's still like a little bit of blurriness in my eye, and then my eye muscle seems very weak. So I think trying to regain the strength back as well in my eye.
Okay, and you're done with the steroids. Are you done with the steroids, or are you still taking the steroids? Something keeps happening. I lost you again.
No, I'm not on the steroids no more.
Okay. So I would recommend that you would use the 3070, the 3070 blend. It's 30% DMSO, 70% castor oil. And I would recommend that you would use it 3 to 4 times a day for 2 weeks, and then drop it to twice a day. So you want to heal the ulcer scar, the ulcered area in the eye, and then you also want enough castor oil in the eye for a 2-week time frame to have it start, getting into the scar tissue and breaking it apart.
Okay.
And then, yeah, once you achieve that, then you're good to go. You just want to skate and do it twice a day, and then you'll be good to go.
Thank you so much, Ms. Leslie. I
You're
appreciate
welcome.
it.
You're welcome. You're welcome. Okay, somebody asked the question about bear tracks, and I pulled it up on ChatGPT. So bear tracks in the eye refer to a specific appearance observed in the retina during an eye exam. Excuse me. This term describes clusters of pigmented spots in the retinal pigment epithelium that resemble the footprint of a bear. These spots are usually benign and are not associated with symptoms, but they can sometimes be linked to underlying conditions. So, in the causes, one is congenital retinal pigmentation, so often hereditary and benign. It may occur in both eyes and remain stable over time. Familial, man, this is a word. Adenomatouse, um, polyposis. Okay, I don't know what this is. A genetic condition that increases the risk of colon cancer. Bear tracks may appear as part of the Gardner syndrome spectrum, which involves uh, extracolonic manifestations of FAP. Eye exams can help identify people at risk for this condition early. There's age-related changes, so pigmented changes may occur in other adults and are generally harmless unless linked to other systemic conditions. And other causes are retinal pigment epithelium changes due to injury or inflammation, and rarely associated with systemic diseases or retinal degeneration. So it says here on under management, if benign, which means it could also not be benign, no treatment is necessary. Regular monitoring during routine eye exam is usually sufficient. If linked to conditions like FAP, referral to a gastro. Hello? Okay, well, they hung up. Okay, referral to a gastroenterologist or genetic testing for FAP might be recommended. Okay, so there's a lot going on when you're talking about bear tracks, and I want to know if you've actually had the diagnosis, and if you have had a diagnosis, have you had any diagnosis around FAP, or if you have any known hereditary diseases in your family that you're aware of.
Hi, good night.
Hi, how are you?
Good night.
Good night, how are you?
I'm just want to find out if you have information, guys, what can I use the information?
So, do you know
Hi, good night. I'm good.
how serious is the inflammation?
I just want to find out if you have information in your eyes, what you have to eat.
So it depends on how serious the inflammation is. You've got a lot of background noise.
Information in your eyes, so I want to know what can I use for it.
Okay, it depends on how serious the inflammation is. So there's different drops depending on how serious the inflammation is. So do you know what your intraocular pressure is? You have a lot of background noise. Is there any way? You have a lot of background noise. Hang on.
Yes, you have a lot of background noise, so it's hard to hear you, and it's hard to communicate back and forth.
Okay. Did they mute their microphone?
It doesn't look like it. I'm not for sure what happened.
Is that Vicky Seastrom?
Yes.
Okay. So if you're listening, and I hope you can listen to me. So depending on how severe the pressure in the eye is, the inflammation in the eye is, where the inflammation is. So inflammation is a broad term. You can have inflammation in your optic nerve. You can have inflammation in the macula. You can have inflammation in the retina. There's all kinds of types of inflammation. You could have glaucoma inflammation. So, or you can have ocular edema. There's just all kinds of things that are associated with the word inflammation. So I need to know more details in order to give you some, valuable information.
User 3699411689716. Are you able to come up and chat? I wasn't able to find you in the list, so I can invite you up. So if you can click the request button to the right of the screen, and we can further assist.
100%. Exquisite Treasures is in the room.
And Precy, I hope I said that right. If I didn't, I'm sorry. But she says, "Hey, Miss Leslie, it's Caprice. My eyes feel great."
Hello.
Yes. How you doing, Leslie?
Excellent, excellent, excellent.
Hi.
How's it going?
It's going good. I'm still waiting for Saturday. I'm way nervous, but I'm making a lot of mistakes, but I'm ready to make them.
Hey, I don't believe there is a such thing as a mistake when you're trying to do the right thing. You're trying to do something positive.
Turn them words around, man.
100%.
I know that's right.
100%.
Speak good vibes into the atmosphere.
100%.
All the time. I gotta change the words around up here. I'm just gonna do it. Yes.
Yes. No, it's gonna be
like Nike, just do it.
100%. 100%. 100%. that I was playing with my granddaughter today. You know, sit on the floor, you spin in a circle, and you sing that song round and round and round it goes. Where it stops, nobody knows. So I was doing that with her until she got dizzy. Um, it was fun. But I told my daughter, I said, you know, that's the way difficult. It's an interesting thing because I feel like that's the way difficult things are. You just got to keep doing them until you get to the point where it's just right. It just is correct.
Absolutely.
And keep going
That's
around.
right.
Keep going around.
We have Redo Car that just joined the chat.
All right, so Capsy Scat. Is it Capsy 5 Scat? You asked, do you do private consultations? Yeah, you can call me anytime. So my phone number is up there somewhere, and it's good in the US. It's good on WhatsApp. You can call me, and we can work it out. I am putting together, so I will hopefully have this next week. I'm going to have an app on my website where you can schedule a call with me. If the call is 15 minutes or less, it's free. If it's 15 minutes or more, it's $25. Because I'm getting
all the research you have to do and
well, and the deal is I'm getting calls so regularly that I'm having a hard time doing anything else. You know, like I'm on the phone with somebody having a call, and another person is trying to get me, and they're just calling back to back to back to back to try and get me to answer the phone.
yeah.
And I'm like, I need to be able to have a schedule where it's these times are shut down because someone has scheduled that time, and that's their private time.
Just wait until you grow, where you have other people answering the phone and answering questions. We're gonna speak that into existence.
No, that's gonna happen.
It's very generous of you to even do the first 15 minutes for free because a lot of people charge for you to even have a minute with them. The information and the research that you've done. So it's truly a blessing.
Well, I want to be able to give people the time that they deserve, and really focus on their needs. And it's not reasonable. Like I have 25 unreturned messages between yesterday and today, and I think on my TikTok, in my DMs, I have like 105 messages that I haven't been able to respond to yet. So like it's big, and with people like the lady that asked the question about PCO, that's such an in-depth question. It's not, it's not like, yeah, no, the 3070 is going to work great.
Right.
It's just not that easy. And then I'm dealing with a couple of gentlemen that have visual snow, and I'm working with that.
That's scary. That right there.
It is.
That's serious.
Yeah, no, it is very serious. And I want to see if I still have it pulled up, because I wanted to give the description. So no, I think, oh wait, here it is. So for everybody that's on the live, and we got 34 people in the room.
Okay, we have Reducar up next, and then Baby Girl. But hold your mute until Leslie's ready to provide you with her undivided attention.
Yeah, just give me a minute. I'm getting closer to what I'm trying to find. So this is the situation that I have a couple of customers in, and one gentleman knew what it was, the other gentleman did not. But so if you ever hear of this, if somebody's reporting this, it is a real thing. Visual snow is a neurological condition that's characterized by a persistent static-like visual disturbance. People with visual snow describe seeing tiny flickering dots similar to static on a television screen, overlaying their entire field of vision. This symptom is present even with their eyes closed and often remains constant, making it a chronic issue. That's what these gentlemen are dealing with. And when somebody that's in that acute situation is like, I want your attention, I don't want to say, hey, hang on, I got another call coming in. Hang on, I got another call coming in. I want to be able to give them my undivided attention.
Okay, Miss. My grandmother said that she have dry eye. Do you know what is good for that?
So who is this talking? Is this baby girl?
Definitely.
Okay, so for dry eye, I recommend that you would use the Revitalize. The Revitalize is huge in the world of dry eye, but I would also recommend that you use the 3070 blend because the dry eye is coming from somewhere. And the Revitalize isn't going to deal with the causation, it's going to deal with the result of you having dry eyes. So it's going to moisturize and hydrate the eyes. The 3070 is going to deal with why you have dry eyes to begin with.
Yeah, so what supplements should my grandmother use?
I'm sorry?
What is the blend should my grandmother use?
3070. That's what it's called, 3070.
What are the ingredients?
DMSO and castor oil.
First time I ever heard of that one.
You've never heard of DMSO?
No.
Most people have not. DMSO stands for dimethyl sulfoxide. Dimethyl sulfoxide is a natural occurring solvent that is derived from the processing of trees to make pulp, to make paper. It penetrates very deeply into the body and it carries with it whatever's paired with it. And I've paired castor oil with it because castor oil is very reparative in the body. So DMSO getting the castor oil very deep into the eye system is a huge benefit.
Oh, that sounds good.
Okay. Do you have any other questions?
Oh, not really.
Okay. All right. Thanks for coming up. I really appreciate you. Okay.
Hello?
Yes. Redo Car?
Yes.
Hi, how are you?
I'm fine, thank you. How are you?
I'm excellent. I'm excellent.
Yes, you hearing me?
Yes, I hear you fine.
Okay. I had called a few weeks ago concerning the surgery I had, the cataract surgery, and the eye drops that I'm taking, which is the Timarol and Lonapros.
So,
And I wanted to know because I was reading up on the Timarol because before I read up on it, I noticed that my eyes, like I didn't know that was the side effects. Like my eyes, like 1 week, my right eyes was swollen as big as a balloon, little exaggeration. And then now it was first the left eye, and then now it's the right eye, swollen to the point where it couldn't open, I couldn't see through it. And
wow.
I did not know that it was the Demerol that was the side effect was so bad because right now I'm talking to you and my eyes is itchy and like in the corner of my eyes feel kind of hard. And I stopped using Timarol for about 3 days now. And as I was reading up, they said that you would have to take it for the rest of your life, or if you stop the effects that is going to happen, like heart condition and so forth. So my question is that I want to stop it because my eyes is in great pain and very blurry and watery, and really I'm going through a lot by using that eye drops. So I know that they said that don't stop it until you talk to your doctor, but it seems like I'm ready to stop it immediately, and I want to know what can I do to resolve this my eye problem.
Okay, so do you know what the last pressure reading was in your eyes?
No, I can't remember the last pressure reading that I took when I went to the doctor.
So I would recommend that you would use the 4NI and the 4060. So, because I'm going to read just a little information about timolol. So, for anybody else that might be using it. So, timolol is a medication commonly prescribed as an eye drop to treat glaucoma and ocular hypertension. It belongs to a class of drugs known as beta blockers, which work by reducing the production of fluid, aqueous humor, in the eye, thereby lowering interocular pressure. So basically, it dries your eye out.
Right, because my eyes is very, watery, itchy, everything.
Yes, yeah, your eyes are drier than the Sahara Desert. So it also, with open angle glaucoma, it helps prevent optic nerve damage by lowering the interocular pressure, which is only, minorly helping the optic nerve. It reduces elevated eye pressure to minimize the risk of glaucoma development. How it works, timolol blocks beta adrenergic receptors in the eye, which decreases the production of aqueous humor. This reduction in fluid lowers pressure inside the eye, preventing further damage to the optic nerve. And then it talks about the dosage and that you should wash your hands thoroughly before using it. Okay, yada, yada, yada. Potential side effects: temporary burning or stinging after application, dry eyes or blurred vision, systemic effects since some can be absorbed into the bloodstream, fatigue and dizziness, slower heart rate, shortness of breath, worsening of asthma or other respiratory conditions, and in rare cases, allergic reactions, redness and swelling, severe eye irritation, or vision changes. So I since you're having this massive swelling, you are allergic to this drug. No drug that you're taking should cause that result where your eye is swollen to that degree. So I would say number one, you're probably allergic to this. And getting off of it was the right answer. However, now you've got pressure buildup in the eye because you've got nothing lowering the pressure. I would immediately put you on my 4 eye drop and the 4060. I'd put you on it 3 times a day. And you would always obviously use the Revitalize. You would have to just deal with pressure for a couple of days because you're going to need to actually get the eyes hydrated and moisturized for 2 days before you start using the 4 and the 4060. But then I would recommend that you would use it 3 times a day, get the pressure in the eyes down, stabilized, and then the ingredients would actually start repairing the health of the eye. So that's what I'm going to tell you. Okay. Redo Card, did you hear me? Do you understand me? Unmute yourself and let's talk.
Understand you? Yeah. Could you say that again?
So I would put you
4060.
4060 and 4NI, the number 4 ANEYE. So you would use, yeah, number 4, ANEYE.
ANEYE.
Yes, 4 and I.
Okay.
And so you would use both of those drops along with the Revitalize. You need to use the Revitalize for 2 days, 5 to 6 times a day to hydrate the eyes. Get your eyes nice and hydrated because they're dry as a chip, and whatever you put in your eye is going to burn like crazy.
Okay, and the 4 and I is how much times a day?
You're for 2 weeks, you're going to do it 3 to 4 times a day so we can get the interocular pressure down and normalized.
Okay.
So for 2 weeks, 3 to 4 times a day, and after the 2 weeks, you would do it twice a day, morning and evening.
Okay. All right. And where do I get this now?
On my website at bearcatbody.com. It's
Could you spell it?
Yes, it's BARE CAT.
DAT.
No, C is in cat.
Or CAT.
BODY.
BODY.
.com. Yes.
And it has the instruction. It has the
So
instruction of how to use it.
The instructions on how to use it would not be helpful to you. You're going to need to use it the way I directed you to get the inflammation in the eye down as fast as possible and get the eye situated where you've got corrective action happening in your eye. So you want it, yeah.
The 40-60 is 3 times a day.
Nope. So for 2 weeks, you're going to use, for 2 weeks, you're going to use the 40-60 and the 4 and I.
40-60 and the 4 and I, okay.
3 to 4 times a day. Both of them together.
3 to 4 times a day?
Yes.
Okay.
So you're gonna do the Revitalize first, the 40-60 second, and the 4 and I third. And you're gonna do that. Is there any chance you can turn Bluey down?
Oh, sure. Sure.
Okay.
Okay.
So you're gonna start with the Revitalize, then you're gonna do the 4 and I. No, then you're gonna do the 40-60, then you're gonna do the 4 and I. 1, 2, 3, and you're gonna do them 3 to 4 times a day for 2 weeks.
Okay, 3 to 4 times a day.
Yes. And then after 2 weeks, you're gonna drop it to twice a day, morning and evening.
Okay, twice a day.
Where are you located?
I'm located in New York, in the Bronx.
Okay, in New York in the Bronx. So if you order, tonight or tomorrow, it'll be there in 2 days.
Okay. And if I could always call you if I'm a little bit more confused. I could still call you and ask you.
You can call me anytime.
All right.
Okay.
No problem. I would order it as soon as I go on the site right now.
Okay. Can you see me? Can you see me okay?
Yes, I'm seeing you.
Okay, so here's what I want you to do. Because you're getting pressure building in your eyes, I want you to use acupuncture to reduce the pressure. In your eyebrows, like right in the middle of your eyebrows, where the bone actually starts to arc, you're going to feel a little divot. I want you to press there, press down for 10 or 15 seconds.
Okay.
You see where my fingers are placed?
Yes.
All right, and then directly underneath, on the bone, on the eye, same thing. Find the little divot. It's like an upside down V, and you're going to press.
Okay.
10 seconds. Then on the outside of the eye,
yes,
you're going to press 10 seconds. and then on the inside of the eye, 10
Yes.
seconds. I'd like you to do that 4 or 5 times a day
Okay.
until you start these drops, because you want to release as much pressure out of the eye as you can. And those acupressure points will help reduce the pressure in the eye. You'll probably feel it in your eye when you're
Yes,
pressing.
I'm feeling it.
You're feeling it?
Yes.
Okay, you want to hold it there for about 10 seconds, and then you're going to release.
Yes.
And does it feel lighter? Do your eyes feel a little lighter?
A little much better.
Okay, do that as often as you need to, but at least 4 times a day, because you want to keep that pressure away. You want to keep the inflammation down as much as possible, and that acupuncture will be very helpful. I mean, acupressure. That will be very helpful to your eyes.
Okay, and what about the nanopros? Should I continue that or?
The Latanapros, if you want to continue it, you can. Once you get my drops, after a week or so, you're going to discontinue the Tanapros anyway. But you're going to, anything that helps keep the pressure down until you get these drops is going to be beneficial. But do not take the Timolol anymore because you're allergic to it.
Okay, thank you very much.
All right, you're welcome.
I'm going to order it.
Okay, thanks for coming up.
Bye. You're welcome. Have a good day.
You too. Okay, that acupressure is really good for anybody that's got glaucoma. Use those pressure points, middle of the eyebrow, directly below the eye, underneath the eye on the skull bone, and then outside corners and inside corners to release pressure in the eye. Okay. Sheldon, how are you doing? Coco, thank you so much for giving her all of those instructions. So Redicard, look at all of the notes that Coco sent you. She sent you all the notes from our conversation. Gigi of 2, I used to use Timolol, gave me heart palpitations. Yeah, no, and that's actually one of the symptoms of Timolol. And I don't believe that anything that's dealing with inflammation in the eyes should be giving you heart palpitations, should cause your heart to actually have any kind of reaction. It's unfortunate. So GG of 2, totally understand that and appreciate you saying it. But I want everyone to know, if you're using Timolol, if you have a new prescription for it, you can have respiratory issues, cardiac issues, diabetes. So Timolol can mask the symptoms of hypoglycemia, such as rapid heart rate. And then obviously you can be allergic to it. So you can have allergy or sensitivity responses. And it says here that it may reduce the body's responses to allergens and anaphylaxis. Like, it's unbelievable. It's unbelievable. So yeah, if you're having a reaction like she's having, where the eye is swelling massively, just stop taking it. Stop taking it. You are either very sensitive or completely allergic to it. Wow. Pink Room says, I'm on Timolol and I'm experiencing all of those symptoms. Oh my gosh, babe. Yeah, stop taking it. Stop taking it. You gotta find something else. If there's another prescription that you're willing to take, do that. Accept the swelling. So you're not allergic to it, which is good. But you shouldn't be taking anything that's causing your heart to react to the drug. That's uh, that's not good. GGO2, I use now Brimidine twice a day and Lumigan.
GGO2 also stated that she has glaucoma and she's going to use the instructions you gave about the acupressure.
No, yes. If you've got any inflammatory issue in the eyes, then the acupressure is huge. It's great. It's really, really good. And use it often. Like use it 4 or 5 times a day. It's really great. Okay. Indie Diva 01. I'm still waiting on my shipment. I totally understand. We're shipping hundreds of orders at a time. We're 2 days ago. Was it yesterday? Yesterday we did 114 orders, and the day before that it was like 140. So I promise you, your order is getting worked. Right now, I think we're at May 2nd, and we're constantly working those orders. I've actually hired a part-time person to help out, and so we're doing everything that we can do. But yeah, Coco's right. If you can give me your order number, I can let you know exactly what's going on with it. Got it. So when you guys come up, if you could turn your TVs down, turn down the background noise, that would be very, very helpful. So your order was placed on May 2nd, and it's a 3070. Yeah, so it'll ship out tomorrow. This is going to ship out tomorrow. It hasn't gotten a shipping label assigned to it, but it should ship tomorrow.
Hi, Sheldon.
Hi, Coco.
We have
Lady Angela 9. Since I've been using my drops, my eyes have been less irritated, if any, and it's only been a few days. That's phenomenal. That is phenomenal. Yay! We appreciate that one. No, that's phenomenal. Very happy to hear it.
Hello.
Hi.
Hi.
Hi, how can I help you?
Okay. This is Samantha. We spoke today, and I was so excited to tell you that I can see. Actually see. Oh my gosh. Yes. Your product is working. Just need patience.
Yes.
Right. It works phenomenally. I haven't worn my glasses from Sunday.
That's fabulous.
I'm training my eyes so that I can see.
Yes.
Without losing it.
100%.
Oh my gosh. Everybody that I know that wears the glasses, I give them your number. So you're going to get more sales. You're going to be more busy.
Thank you. So what drops are you using?
I'm using the 3070.
The 3070.
And the Revitalize Eye.
Yeah, the Revitalize.
Yeah, the Revitalize. So that's what I'm on. I use it 3 times a day. You tell me to use it 3 times. And today I also told you I have Refresh that I used to use in the past.
Yes.
I haven't used it since I'm using your product. And you said, yes, I could also use it if I want to.
Yes.
Because I have so many of them, I am going to use it.
Yeah, no,
So
I
along with your product.
yeah, I understand. Yeah, there you don't want to waste that money that you spend on those refresh drops.
No, I buy them from Castor. That's a lot. I bought
Yes.
like 4 in the box. Yeah, so I really appreciate it. And I did buy them the drops from my husband. And let me see which one is. And he's telling me that he didn't get any direction. He probably just don't remember how you said he should take it. He has the 40-60 blend and the 30-70 and the Revitalize. Also.
Yes.
Remember, he had swelling in the back of his eye, inflammation. So he wanted to know how he's supposed to take them.
So he's going to use the 3 drops together. So the Revitalize first,
Okay.
then the 30-60. Then the 30-70, and then the 40-60, morning and evening. And I want him to do that for 7 days.
Oh dear. Okay.
And then after 7 days, he's going to use the Revitalize and the 30-70 in the morning and the Revitalize and the 40-60 at night.
Oh, okay. I will definitely let him know.
Okay.
And I'll come back with my results.
Excellent.
But I'm just letting everyone know I was a skeptic, but now I'm a believer.
Well, thank you so much.
Definitely try the product. It works.
Thank you so much.
Leslie, I really appreciate it, really from the bottom of my heart.
Well,
I haven't seen out of my own eyes since 2003.
Wow.
I've been wearing glasses. As soon as I wash my face in the morning, I slap them on. So this is the first time I'm really going without glasses. Everything looks kind of blurry from a distance, but it will clear up.
Yes, it'll get better. Your eyes will get stronger week over week.
And I'm also doing the exercises that you told me about and the ones that I heard about. So
okay.
I'm working on it.
Excellent. Excellent.
All right, have a good night. I'll be off and I'll talk to you soon.
Excellent. Thank you so much.
Thank you. You're welcome.
All right. Bye-bye. Ah, yay! That's fabulous. That's fabulous. Your eyes just get better. They just get better. All right, Christian Barra. Hi there. Hi. So you ship to Iceland. I can ship anywhere UPS, FedEx, or DHL can go. So 100%. Absolutely. Absolutely. I ship worldwide.
Wendy asked if you were able to find a different solution for New Zealand, to ship to New Zealand.
So not one that made any significant difference in cost. The cheapest cost I found was DHL, and it was $69 instead of $71. The thing that I would love to do is get 4 or 5 people that want the product together to share the shipping cost. Ship it all to one location and then have you guys just disperse it out. But there's really just right now, with the way all the shipping costs are going in this country, leaving to other countries, it's just bloody expensive. All right. Dan Misimba wants the website. Coco, can you send him the website?
She got country. I'm not for sure if you answered that one. I have a question. Where do you apply the product 3070 to the eyelid or directly on the eye?
Directly in the eye, as an eye drop. So drop it directly in the eye. King Sam 24, how you doing? Come on up and say hello.
And while King Sam is coming up, we have BX Apache 41 stating waiting on for an eye. Is it on back order? Question is, what is your order number? If you can send that to Leslie and let her know when you actually place the order.
Yeah, I'll pull it up here because it's not on back order at all. I'm making more tomorrow, as a matter of fact. But give me if you've got your order number, then I can look it up and see where it is in the process.
They said they're getting emails. Okay, yeah, please share your order number so that she can look it up as stated, so that she can look it up, see where it is in the process.
All right.
Barra stated, I have chronic dryness in my eyes, farsightedness, and acuity. What should I order?
So I would recommend that you start with the 3070. You're going to use the Revitalize that you get. It's a companion product that you get when you order the 3070. You're going to use the Revitalize 5 to 6 times a day for 2 days. And then you're going to start the 3070. And you want to use the 3070 morning and evening. And you always want to preface using the 3070 with the foreign eye. So foreign eye first, and then the 3070 twice a day, morning and evening.
Okay, I think that's what we have so far. Just waiting on that order number. Oh, there we go.
Azael EL says, Spirit sent me to this live. Hang on a second. I got a call. Hello, this is Leslie.
Yes. Good afternoon.
Hi, I'm on live on TikTok and YouTube. Is it okay if we talk while I'm on live?
I sent a message that's Danny Simba. That's I'm just watching at the on you're on online, yes?
Yes. Yes.
Yeah, that's what I'm watching. I'm watching the I don't know. I see the screen, the number, and I couldn't switch it to talk because I had a retinal detachment last June 2024. Then that's in my right eye. You hear me?
Yes, I hear you.
Yeah, I'm just talking to you driving because it is hard to me that it's raining, so that's why I don't want to miss this conversation. So that was in June. In June 2024, I had a right eye, the retinal detachment. Then I can't recover until 2 months, like the doctor says. So after that, then it became too blurry. But and I go back to the doctor and why I'm not seeing like before, and they say no, it takes a time. Okay, now you have to make a cataract surgery. Then I make a cataract surgery with aid of laser. It's okay, but I feel sometimes, I can't. If I use sunglasses, I can see better. Otherwise, if I took the sunglasses and then it gives me dizzy, I can't because it gives me dizzy. I want to fall down.
Right.
So I don't know what happened. Why it happened that with the glass is okay, with no glass is not. Yes, okay. I mean the sunglass, not the side glass.
Right.
So now the last appointment, I went to the doctor because I had an inflammation, not only in the detachment side, on both of eyes. I had he says that, no, maybe you have the dry eye. Then I say, oh, okay. And then he gave me the anti-inflammatory, but I'm using it. I'm okay, but still not okay. But my question is, how I'm seeing with glass and not with a glass. And then at night, still my right eye is a glare. So I'm using the anti-glare glasses, but it's still the same. But my concern is when I walk with no sunglasses, it gives me dizzy. And then also it's not, the right eye is more brighter than the left eye, more white. So, and when I see this, so my first time, and I see this, the Miss, she's giving something like, I'm sorry by my English, but and I was very happy to hear that, and then I'm following her. But I don't know. She gave I need the website, and I need what revitalize to order it. I don't know. I don't know what I can do.
Okay. You need to revitalize to deal with the dry eye.
Okay.
When you had the retinal detachment, did you do a surgery where they put a gas bubble or an oil bubble behind the retina?
Yes, gas bubble.
Okay.
It never go away until 8 weeks.
Right. And how many weeks has it been?
It's been like almost 9 weeks with that, and then sleeping, face down, and that's unbelievable time. So it was 9 months, 9 weeks.
9 weeks.
Yeah,
so,
and then still I have the floaters.
Yeah, and you're gonna have the floaters until you use something that can actually dissolve the floaters in the vitreous fluid. When you're walking and you're getting dizzy.
Yes, but I put the glass, the black glass, the sunglass, a little bit okay because it balances the brighter, and then you know what I mean, because the right eye is more brighter than the left eye. The left eye is yellowish, the natural color.
Yes.
But that one is very, very, very white, brighter. It's not shadowing. It's not like the contrast is very high contrast, high. You're getting brighter.
Yeah, you're getting too much light. The way the light is being focused into the eye, you're getting too much light.
Yes, when I see the green, the left eye, it see the same green, but when I see the right eye it's brighter green. You know what I mean? I don't know how to explain it.
I understand. So here's what I'd like you to do. I would like you to get a patch and patch over the eye that had the retinal detachment.
Patch means that they call the patch?
No, just put just like a big Band-Aid, just a patch over the eye. So you're only looking out of one eye.
For how long?
I want you to do that for the whole day. So the next 2 days, I want you to patch the eye when you're out and about. So when you're out in the world, you're not at home, you need to wear a patch. When you're at home, you can take the patch off, but when you take the patch off, close both eyes and then open both eyes at the same time after you take the patch off.
But the problem is my job is related with the vision. I mean, I'm driving a big truck, so.
Well, your vision is not going to get better until you're going to have to do some things to get your vision better. Your retina detached and it has not reattached correctly. And it sounds to me like your retina is actually moved from when they place that bubble to put the retina in place, that it's moved.
Oh, I feel like that because sometimes I see that my right eye is off center because
right.
Because when I have to move, when I open two eyes to concentrate the center of the focus, and then I try to move it by force, my right eye to the left. That means that the both eyes is seeing correctly, but I'm putting force, so that's why I feel it something not okay. Yeah, it's very strange feeling.
Right.
So don't know how you can help me. I don't know.
So here's the other thing you can do. I want you to actually spend 10 minutes every couple of hours. I want you to look at the floor. I want you to spend 10 minutes looking at the floor. Head down, look straight at the floor.
Head down?
Yep.
Okay.
So you're just going to, if you sit, just look down between your legs at the floor. That's going to let gravity pull the retina where it's supposed to sit in the eye.
Oh.
Okay.
Oh, yes. My habit is a problem because I have heart palpitation. I have to see the doctor now. I have an appointment. My problem is I sleep face up all the time. That is my problem also.
So can you sleep on your side?
In my heart side, I don't feel it's okay. But in my right side, yes.
Okay. When you get up in the morning, instead of getting up immediately, spend 10 minutes looking down at the floor.
Okay.
You don't even have to have your eyes open. You can have your eyes closed, but you want your gravity to be pulling the retina where it needs to be in the eye. Look at the floor.
Okay.
Okay.
Yes. So, how it helped me that your product? You mean it can help me for something, or?
Well, I think that there are things that my products can do to be helpful. I'd really like to talk to you more, like off of the live, so I can get to some other people. But there are some other questions that I want to ask you about, just how your daily life goes, so I can understand when you can wear an eye patch and when you can't, and how you're using your eyes. If you're driving a big truck, you're looking all over the place. Your eyes are constantly moving. That's not good for a detached retina.
Okay. So, what you recommend me that the patch means just cover my eyes for about 1 day every time, or just 1 day?
Well, I would want you to cover your eye for a number of hours a day. So, and it doesn't have to be like when you're driving, but when you're done driving, patch your eye. I'd like you to look at the floor for 10 minutes. After 10 minutes, raise your head, look normal, and then patch your eye. And put a patch over it, and then wear that patch until you go to bed.
Patch means cover, yes?
Yes, cover it.
Okay. Oh, yeah, I see what you're doing, yeah.
Because you're making your eye is hurt, and you're causing it to work just as much as your non-hurt eye.
Yes.
It needs to work less so it can heal.
Okay, Mom. Because I couldn't speak with you with the TikToks, the system, because I'm just driving right now. I'm in Missouri now, so and it's heavy rain. I can switch it to with it and a setting and go there and that. So that's why I call in this number.
That's fine. No, calling this number is fine. But I'd love it if you'd call me tomorrow so that we can talk some more. 10 o'clock.
10 o'clock.
10 o'clock Eastern. Yeah, 10 o'clock in the morning Eastern time.
Where you are?
I'm in Florida.
Oh, okay. That's East time.
Yes.
So yeah, because we have 3 hours back.
Okay, so you're on the West Coast.
Yes, but now I am in Wisconsin. Almost that's the Eastern time.
Okay. Well,
10 o'clock? Okay,
10 o'clock. Yeah, call me and then let's talk.
Thank you so much. I'm very, very happy about the video you're doing that. And then really, just like when I click it, immediately give me my problem. Oh, my goodness. Follow you. And then,
Well, thank you so much.
I'm watching, listening. Oh, God bless you, Mom. That's you. You are for us.
Thank you so much.
And I'm sorry for my English.
No. Don't apologize at all. Your English is very good.
Thank you. Encourage me more.
No, absolutely. I know people that were born in the United States that don't speak English as well as you do.
Yeah, no, because I grew up in Germany, I have a German accent also, but
Okay.
I'm from South African person. So
Oh, okay.
Yeah, and I speak a different language, so I have sometimes language interference, so it makes me go. So, but I'm very, very happy. God bless you. You are really, really good. God sent you.
Thank you so much. I appreciate you.
My name is Daniel.
All right,
Daniel.
Daniel.
And TikTok is Dami Simba. Okay, thank you so much.
Okay, I'm gonna save your number so that I know when you call me tomorrow. Okay.
Okay, Mom. This is Daniel.
Okay. Thank you so much.
Daniel Simba. Thank you so much.
All right. Drive careful.
And I want to listen you in the TikTok too.
Okay.
Okay. Bye.
Bye.
Thank you.
Okay. So, all right. So the gentleman with order, hang on, ending 3680. I don't know how it is your order hasn't shipped already. I completely apologize. Because obviously the shipping label's been printed, but it has not left the my environment. It will be in the mail to you tomorrow without a doubt. Your shipping label is going to change because I'm going to take off this shipping label and do 2-day shipping direct to you so it gets there as fast as possible. And I am also going to issue you not a total refund, but probably a 50% refund on your order since it's taken us so long to process your order. I sincerely apologize for us not getting it out sooner, and I don't know how it got missed, but we will get it corrected and get it to you ASAP. Okay. I want to, hang on. I just want to save this guy's number that I just got off the phone with so I know when he calls me tomorrow who it is. Okay, got it. So who's up on the panel now?
We have Archie Money. Archie, if you can unmute your phone and go ahead and speak.
Hi, good evening.
Hi, Archie. How are you doing?
Yeah, I'm good. Yeah, I spoke to you this afternoon.
Okay.
Yeah, I'm trying to order for the what's it called? 4 and 9.
You're trying to hold out for the 4 and 9?
I'm on my laptop now trying to order for 4 and
9. Okay.
And it took me to a page. Right now I'm going to continue with shop. So I don't know how to make the payment.
Yeah, you don't have to use shop. I don't know what's going on. Like a lot of people are getting in this pattern where you have to use shop pay to pay. I don't understand that.
I have to use my card. I don't know how to do that.
Yeah, you shouldn't have to do that. I don't know why it's pushing you there.
I'm trying to think based on my order. I think it gives you options to pay with shop, but I'm thinking it also give you the option to pay using a different method.
Yeah, I did that. I click on pay with different method, and it still took me to a page where it with shops, show the other numbers and some other things.
Okay, so even when you select the option to pay with shop, does it then prompt you to the payment?
Let me go back and try to See what is. Okay, 409. More payment options.
Yes, that should be it. So then I'll have to go. Should be.
Okay. Okay, I think I got it now.
Yeah, I think it gives you that option to go through shop, just like
BS
Apache was stating, so
contact.
that it can track it. Yeah, I think it's more just a way to track it.
Okay.
Track the order.
Did you get where you needed to be?
Yeah, I think I got it now. But the issue I have now, I'll have to start again. Because I only click for 1, 4, and 9, and it brought 2. Then I saw free revitalize here. He did not ask me to get that.
So the revitalize will automatically get added to your order during the checkout process. You don't have to add it.
Sorry, I didn't get that.
The revitalize will automatically get added to your order. You don't have to add it.
But it shows in my payments here.
It shows a charge.
Yeah.
So take it off. Just take it out, because you'll get that automatically for free, whether you have it in your order or not.
I've tried that and it's not. I'm trying to delete that. I don't know what is happening. Why is it still there?
Try to empty your cart and then just add the 4 and I again.
Let me log in again. Sorry, please. You actually choose food blocks for me. 4 and 9, and
Are you there?
you choose 4 and 9 and 46. Can I get 4 and 9 now because of the cost? I don't know if it's possible to get the 4 and 9 now and later the 4060.
Yeah. Do this. In your cart, choose the 1 ounce 4 and I and the 1 ounce 4060.
Sorry.
So take out the 4 and I, and when you go to 4 and I, there's 2 options. There's a 1 ounce and a 2 ounce. Choose the 1 ounce.
Okay. The 4 and 9, 2 options.
Yes.
So I choose one.
Choose the 1 ounce. And then for the 4060, choose the 1 ounce.
Sorry, I didn't get that. Please, I'm sorry.
You didn't get the 4060? You know what we should do? You should call me and I'll place the order for you. Can you call me tomorrow and I'll place the order for you?
Okay, tomorrow morning. Okay.
Yes, absolutely.
What about the payment? I'll send the payment to you.
Yeah, no, I can take it over the phone, or you can cash at me, or you can do any number of payments.
I can send it to 2 phone. No, I told them in Canada.
Okay, I have. Do you have Wise? The Wise app?
Yeah, I did. I checked it already this morning, this afternoon.
Okay, I have that too. You could send me it on Wise.
Okay. I'll call you tomorrow. I'll call you tomorrow morning.
Okay, excellent. Thank you so much.
Thank you so much. I appreciate it.
All right. Yeah, BX Apache 41 says it wants you to download the app after you pay. on the site. Shop tracks the order. Oh, okay. Yeah, and that's not necessary because UPS is going to track it anyway. Unbelievable. Unbelievable.
The other thing is, it also, it does the same, like you said, it does the same in UPS. It also kind of shows from when the shipping label is created and once you receive the order and all that other jazz with it as well. So
exactly.
You have a message from Betsy. She wants to speak to you, and I just told her to contact you directly at the top of the screen. We also had, you can call me Toe. He wanted to give you an update.
Come on up.
I invited him up. Let's see. I don't see him on the list, so you can call me Toe. If you can press the request button on the right side of the screen, we can bring you up on the panel so you can chat. Or if you look right above Leslie's head, that is her direct phone number. You can give her a call at that number.
Yes, you can.
And we just invited Jean up to the panel. She wanted to give a shout out. You got a testimony from Jean. It was a good one last time.
I did want to talk about my situation, but I gotta say, I am so impressed with what you guys are doing. I've been sitting here listening, and I'm like, good God, I'm waiting on them ladies. I am so blown away about your team and you and helping these people. Oh my God, I'm almost in tears.
Well, thank you so much. Thank you so much.
Oh my God, I said, listen to these. I mean, it may not be nothing to anyone else, but I'm just listening at these guys, not the diagnosis, but these issues and different things. And I said, why aren't the doctors telling people these things? Here you have a lady who has used her own body as a tester, and then comes back and help us.
Yeah.
And your team is on the line. Oh, thank you. I'm just saying. I do have something to say, but I'm going to call you tomorrow. But I did have a lot of issues. I want to keep hearing all this information.
Can you believe this team of people has never met in person?
I know. I've been listening to all this. But I'm just saying, when you're singing together, when you're on one accord, there's nothing you cannot figure out.
100%.
100%. I know you don't want all this praise, but you are definitely our queen.
Thank you so much.
She sure is. And Miss G, we're also customers too.
Yes, I think that's another thing.
Yeah.
You're sacrificing yourselves to show us things. I am so appreciative. Y'all just don't know. But I'll do that later. But I did order the 75 to what it is. Anyway, I had some body issues.
Hello.
And I've been using that on
Yeah. Miss Bessie? Hello. This is Leslie.
Ma'am?
This is Leslie.
Yes, ma'am. Miss Leslie, this is Miss Bessie.
Oh, hi. I'm on live on TikTok and YouTube. I just want you to know that.
Okay, well, I only have TikTok.
Okay.
Yes, ma'am. Are you on TikTok right now?
Yes, I'm on live on TikTok right now.
Yeah, I'm not savvy with technology too much, but I did manage to get back to my dialing pad where I can dial you.
Okay, great.
Yes, ma'am. But the gentleman that was on the last call you had,
Uh-huh.
I got the same kind of condition with one. I got one eye. Just my left eye is working. My right eye was serviced by a doctor with laser.
Oh my gosh.
Yes, ma'am. And I've been going to this doctor here, but I still got problems with my left eye. It runs a lot of tears, and I did have a cataract surgery, but that didn't help me too much. You know, it used to do good, but now it got bad. I'm 71 years old, but I still drive myself, but I can't drive at night.
Okay.
Or late evenings.
Okay.
Yes, ma'am.
Well, it sounds like you've got dry eye, and we'd have to solve that first. The eye drop that I recommend is Revitalize. I would want you to use the Revitalize eye drop. And I'd want you to use it 5 to 6 times a day, probably for 7 days. And then let's see what your eye does and how it, improves. And then we could talk about what the next steps would be.
Yeah, that other eye is it used to be look normal a long time ago. This happened a long time ago. And my right eye used to look like nobody didn't think I couldn't see out of it.
Right.
Because it look normal, but now it done went to hell. Excuse me. It done turned white, and it's not stable anymore. It kind of drifts.
Yeah.
Yes, ma'am.
Yeah, all the muscles are weak in the eye.
Yeah. And I didn't know you could have a surgery to retach your retina, because if I knew that, I'd have tried to get that in the beginning, but now I don't know.
Well, a lot of people have retinal surgery and it doesn't do a whole lot of good. So it depends on your situation and the doctor that's actually doing the surgery.
Oh, okay. Yeah, I never did anything about it. I keep going to this doctor I'm going to, and he won't act like my eyes doing good, and I know they're not.
Yes.
And I need to get away from that.
Yes.
He's not helping me. He's not helping me.
Well, and here's the deal: the version of good that doctors tend to use when they say things look good.
How many drops should she drop, and should she put that also on the bottom of her feet as well as the top?
Yeah, I would do the whole entire foot. You just want it to absorb, and then put a sock on. And my preference would be organic cotton socks. Put the organic cotton socks on the feet and let that just absorb. You don't want to do it too soon because it can actually irritate the skin.
That was going to be a hard one because of the neuropathy. She has issues even wearing socks for the most part, or any enclosed shoes.
Okay, I totally understand that. Give it a few days for everything to start to change.
Okay.
And then you just want to keep adding. You want to keep adding so that the change becomes a bigger change.
All right.
Kind of like using the vibration plate. First, take it out from under the bed.
Girl, we not vibration thing alone. I get on it every. I'm gonna do a new video with my vibration plate. Okay, Dana. So it's gonna be up to you to do a live with the vibration plate, and I will get it out from under my bed, and then I'll bring you up. So you can get on yours. Okay, there you go. Okay, let's see well, I know I got stuff to do tomorrow, so some stuff, but yeah, we'll do that. I'll let you know. Okay, no problem. You see me now. When you see me come up, are you gonna go get it? It's literally right up under my bed. Okay. All I gotta do is pull it out.
There you go.
Yesterday, Leslie, we had a live, and Sheldon was there, and Coco was there, and we had a good time for about an hour and a half.
Awesome.
We talked about everything. We talked about eyes, we talked about toothpaste, we talked about life.
I'm upset that I forgot that Monday you were added to the website, and I could have reached out to you and say, hey, make sure you put that in there too. And I was gonna send you my payment, but I got you. Next year, you put the toothpaste up Sunday.
Yeah, no, the toothpaste is back live on the website. The toothpaste and the deodorant.
Yeah, my sister, you just put it up. It's Monday, right?
I put it up on Saturday night.
Oh, okay.
My sister texted me this morning and she ordered the toothpaste and the deodorant. And then she asked me, was I going to get the deodorant? And I said, I'm just working with what I already got. I'm happy with what I already got right now for my deodorant. So she
looking
for another deodorant because she didn't like the one that I had because I do it all natural too. And she
me too. Have you tried the crystal stick?
Yeah, I had that before. I did that a long time ago. You wet it and then you I used to do that years ago. But y'all ain't gonna believe I use milk of magnesia and I put some drops in there that I have and then I shake it up and that's what I've been using now for probably the last 6 to 7 months. And it takes me all day. It's not a 2-day thing, but it is a 1-day thing. So, and I'm happy with it. Cool.
Milk of magnesia.
I heard of that. Milk of magnesia.
Where did you pull that recipe from?
I
just want to know.
On TikTok. Look, I have life-changing things in the last few years from TikTok. Okay,
that's awesome.
And I don't get mad. I'm telling you, from losing weight to eating Leslie to doing I have life-changing things that have happened to me in the last couple of years off of TikTok. Meeting people on the TikTok. Growing food in my own backyard, all kind of stuff.
Oh, that's awesome.
All kind of stuff.
Yeah.
I have this foreign eye in my eye right now, boy.
Yes, and
I'm just waiting.
I'm just waiting.
I'm just waiting.
The sting is going to stop in a minute here.
Oh, yeah, most definitely. That's awesome. It's worth it.
No, it's good stuff. It's good stuff.
You're talking about she lost over 150 pounds in 13 months.
Wow.
On the vibration plate? Yes.
On the vibration plate?
Y'all gotta remember the vibration plate is just one tool that helps you.
Right, exactly. Absolutely.
Along with changing how you eat, drinking more water, other things like that. But it's be a consistent thing when you're not even doing the other stuff.
Right.
Because it is working the muscles as though you were walking, jogging, swimming, and all of that.
All the muscles in the body.
Yeah.
Up to an hour a day.
It's only 10 minutes.
She said she don't an hour a day. Hey. She probably had to build herself up to that, so I know she did. Right. Oh, right. Yeah, that takes some time.
Bahia.
Yes, it's Bahia. She's up on the counter right now.
Tell me about it. I'm not even going
there. I bought the vibration plate from TikTok. I use it 30 minutes in the morning and 30 minutes at night. So an hour is nice in a day. And then I follow a high protein diet with lower carbs. And then also the castor oil, I put it on my belly button and my arms and I do that. Yeah, because I'm really into herbs and natural products. Like I even have an LLC for my own hair company where it's castor oil based. So I learned a lot about castor oil. In the past, before I came across this stage, I was putting on the outside of my eyelids. I didn't know until I bought the products that I could actually insert inserted in my eyes because at one point I was just putting on the outside of my eyes. But then I came across this page, which I love, and I love the products. Which leads me to Leslie. I really wanted to talk to you because I remember we talked about how I wanted to get the 4-9 for my mom because the retinitis pigmentosa runs in our family.
Right.
So I finally had a conversation with her today. I seen her today, and I went over to her house, and I had a conversation with her about it. And she was like asking me a bunch of questions, like, is she a doctor? She is. I said, Mom, it's more of a holistic approach. It's all natural. So it's going to be stuff that the doctor is not going to tell you that's more beneficial because they want the coins. It's all pharmaceuticals. They want you to keep coming back. They want you to keep paying for whatever you're getting done, in which your eyesight is still declining. So she said she would take a look at your TikTok. She's going to use, because she raised my niece and my niece live with her, so she's going to use my niece's account.
Okay.
So like join the lives and, check things out, some of your videos that's already been posted.
Okay.
And I did tell her I really would like for her to do it. I did explain to her that the first few days that I used it, it did burn a little bit. Mine don't burn anymore. Is that a good thing? Or
that is a good thing. That is a great thing.
Okay, because it doesn't burn it. I'm probably day 12 or day 13, somewhere around there.
Right.
And mine, it don't burn anymore. And I also stepped up to using it 3 times a day. Is that okay?
That's okay.
Okay. So I'm just loving it. And I told her I could just see the difference when I'm driving. The sun glares because my eyes is real sensitive to light. Because I also have a double stigmatism in my left and a single stigmatism in my right eye. And I could tell the difference with using the drops. Like I had floaters. I don't have floaters at all anymore.
There you go.
So, I'm trying to convince her, but sometimes she could be hesitant. And I told her, you had this condition since you was 36 years old when you was diagnosed. You're now about to be 60 this year. What do you really have to lose at this point? Try it out. If you don't like it, don't use it. But I told her I would even purchase it for her. Just, if she's skeptical about it or whatever. But I'm just so dedicated to using your products. Like I told you, even my younger children, oh, Mom, you about to get your eyes? Yep, sure am. I told her I take my vitamins.
No, 100%. 100%. It's very valuable.
Yeah, because my niece, she was complaining today because she wears glasses. She was complaining today that her glasses is no longer working. So, when I was having a conversation with my mom, I also, included my niece in on the conversation and told her, to try it out too, because she's a big TikTok girl. So I said, you might get on here too and try it out. You try everything else from on TikTok.
Hey, that is my place to shop.
Yes, like I had got the vibration plate, the twisting abs thing. I don't use that. I will say my kids like to play on that. I have not used that. Like, I got on it to try it, but I really wasn't into it. So my kids use that to play, but I don't know if I told you I'm a behavior consultant. So I heard that vibration plate is also good with children with autism.
Yes.
If anybody, has a child or know any children who have autism, it's good for them to get on it about 5 to 10 minutes a day themselves as well.
Yeah, well, vibrations and frequency are good for a whole lot of different neurological issues.
I was wondering, is there a study that shows that cleansing the lymphatic system is good for autism? I wonder
I'm just thinking also of a mental detox. You know how when they get the Epsom salt, the clay in the water, and that kind of mental detox is really good for that. Like I had children who weren't speaking, and parents started the mental detox bath, and their children started speaking.
Yes.
Awesome. So that's really good to try. Because I love the holistic thing. I love natural. When somebody tells me natural 100%, I'll be all in.
I am the same way. My ears perk up like a little song. You know how the ears go up in the air when they get stimulated or
or whatever. That's me. Say something about some herbs. Go ahead. Say something natural. Go ahead.
You're like a telescope on a submarine.
You have to understand, doctors, the way they get paid is if we keep coming in and spending money with the pharmaceutical. You know, they're not paid to heal us. They don't even treat us. They get paid to keep treating us for the condition. But if we get rid of the condition, then they no longer get paid. So that's why, you know, they there to just treat, not heal. And that's why I became into holistic healing, because I understood that concept. They just want to treat.
Well, they don't actually study healing.
Nope.
They study symptom management.
Yep.
That's it.
That's why that pill popping came into the scene. Yeah.
Well, and it's
prescribe. That's
yeah.
it. And then also going to school for psychology helped me to understand a better holistic approach to things too. Because once you have to do biology and all types of courses and stuff, you begin to understand like how natural products, the earth, what we was given, you know, that's the cure right there. Before the doctors came along, before the pharmaceuticals came along, we were healing from the earth. Exactly. And if you could go back to that, you know. I mean, we pretty much need to go back to that anyway. To be honest, with everything going on, yeah, we ain't gonna get into that, but yes. That's a whole conversation. Oh, that's a whole conversation. But not even just for that reason. We need to get back to our roots and go back to natural, what works for our body instead of all these synthetics and man-made mess. Not just medicines. I'm talking about food as well. I mean, it's a holistic, not just one thing you got to work on. No. Sure. Absolutely. And that's one of the things why I was happy to return back to school, because me and my husband want to come together and do, like, he wants to do sports fitness because he does boxing, and I'm more so of a behavior consultant, but we was like putting things together, and we was like, okay, so we look at it at a holistic approach. You know, I can help on the behavior mental aspect, but I also can help on the herbal concept, because I do have a herbologist certification as well. Mm-hmm. So, you know, we were thinking about it like a holistic approach, changing, you know, physically, mentally, behaviorally, all on a holistic approach and a natural approach. From the way you eat, the way you think, you know, the things that you consume, the energy around you, you know, everything. Yes. Mm-hmm. All of that. All of that.
It matters.
I have a question from I'm not going to keep you guys too. No problem, girls. Just stay around. Okay, so
You can hang out.
I just like, you know, your lives come on soon as my babies go to bed, so I'll be all tuned in. But my babies go to bed, they get loud, I'll be all tuned in. Yeah, girl, stay around. I want to step back and let everybody else too. Yeah, right. But we do have a question from Willow Boyd. I have flutters and have been getting shots in my eyes for 8 months, no improvement. But the doctor say, and I went ahead and just invited them up. I think there's a problem with trying to get them up on the panel. But yes, let's have a conversation, Willow Boyd. Make sure it's. I don't know why. I keep hitting the invite button to invite them up.
What's the handle?
Willow Void.
Willow Void.
Oh, Sarah Richard. That was actually Dana that recommended that. Not me. But it was a good idea, though. The alcohol spray when traveling.
Yeah, 91%, or 99%, 91% isopropyl alcohol.
Yeah, you can put like some lavender spray oil in it, whatever you want. If you want to do that, I do that sometimes too. But I just keep it a little spray bottle with me in my travel kit. And every hotel I go to, Willow boy, we hear you. If you can turn the background. Okay. Yeah, I just do the curtains. It's everything. I just go to the room and do it, just so I can feel a little bit more comfortable. And I've never had a problem. I do it like if I'm going on a bus trip. I spray down my chair that I'm going to be sitting in for 7, 8, 9 hours. Whatever. Because right. Willow, it was a lot going on there. Yeah, make sure you they're a little. Turn down the volume a little bit in the background. Because otherwise it's coming over where it's so loud that you can't really hear anything else. No, okay, yeah, it's amazing. Willow Boy, you can go ahead and unmute your phone. Hit save. Hit that microphone and then hit save. We can't hear you. You're still muted. I think your lips moving. You're still muted, so click on the microphone and then hit save. You're still muted. And we can't help her. Yeah, we can't. Right, it won't allow us to unmute it. Yeah, no, it won't. Okay. There you go. There you go. There you go. Okay, hear me now? Yes. Oh, okay. I was wanting to ask you about floaters. I've been going to my eye doctor for 8 months, getting shots in my eye, and the floaters are not leaving. Are they giving you shots to get rid of floaters? Yeah, because he said that there's a little bit of blood fluid building up in the back of my eye that they're trying to get down. It's decreased, but then I got these black floaters that are floating in the eye that won't go away, and it keeps giving me shots. There's no shot that's going to get rid of floaters. And your doctor should know that. Oh, he gives me shots. I had to go this week, and I said, I'm not going. I'm not going to keep having a bill for $3,000, and I still have the shot. I still have the floaters in my eye. Yeah, no. You can go for 18 months. You can go for 80 months. Okay. It's not going to get rid of floaters. The 30s. Because all he told me was, I said, I can't take getting these shots all the time. And he said, well, then you're just going to go blind in that eye. Okay. Yeah, okay. Well, thanks a lot. Really appreciate you. Yeah. Yeah. So, that's no. I said I'm not going this time. I'll just not even go for the appointment. I'm done. There are not only 2 options. And the 2 options are not, do what I say or go blind. That's ridiculous. Yeah, I thought that was a pretty bad thing to say. It's a horrible thing to say, and it's meant to scare you. Yeah, it did, and then I have to go through those tortures of getting that shot in my eye. And every time I come back, it's the same thing. I still got the floaters in my eye. Yes. Yeah, do you know what floaters are? No. Did your doctor, did he even explain what a floater is? No. I swear I spend time trying to figure out how to be kind to the medical community. And then these stories come up and it's like, what's wrong with these people? So floaters are actually when the vitreous fluid, where the lens of the eye lives in this vitreous fluid, that vitreous fluid is made up predominantly of collagen and hyaluronic acid. As we age, the vitreous fluid tends to dry out. We're not replenishing it, so it is what it is. The collagen clumps together and forms what's called floaters.
It's just the collagen material clumping together as it dries out in the vitreous fluid. Castor oil breaks up those clumps.
Okay.
There is no shot. There's no prescription medication that gets rid of floaters. So
that's something we just live with, or
no, I used to have floaters prolifically, but I used my castor oil and DMSO, and I don't have floaters anymore.
So how do you use that?
As an eye drop.
Okay. And use it like on a daily basis?
Yes, twice a day.
Okay.
Morning and evening.
And which one is that one? Say it again.
30/70. The 30/70 blend. It's 30% DMSO, 70% castor oil.
Okay. I guess I'll try that. Go natural.
It's going to be way better than what you've been doing.
Going to get the shots, and then I get that bill off the time.
It's ridiculous. Were you ever diagnosed with any kind of macular degeneration?
No, I had a cataract in that eye, which I got removed, and that helped a whole lot.
Yeah. Did you have glaucoma?
No.
So this doctor, you should sue this doctor. I would want to sue them, because I don't know what medication he was actually putting in your eye, but there's no shot for floaters.
Okay.
So if you didn't have macular degeneration and you didn't have glaucoma and you already had cataract surgery, there's no reason for him to be giving you shots, and you didn't have diabetic retinopathy.
It sounds like the reason was the $3,000 she claimed that she had to pay every time.
No, 1,000%, 1,000%. But that's abuse of the medical system. Like, that's abuse of the system. He's charging you to treat something you don't even have.
Yep. I think I'll buy a bottle of that and use the eye drops. I got used to it, and I said, well, I'm not going back to get tortured for those shots and coming out with no results.
No, 100%. If it was something that was a viable option, there's no way it would take 8 shots. That's ridiculous.
Yeah. And then they're calling, well, you're due for your shot. And I'm like, and when I told him that it wasn't helping, he got a little attitude and say, well, then you'll just go behind in that eye. Well,
yeah.
Lord. Yes. Block his number. Block it. Just block it. Yeah.
Yeah, exactly.
Oh yeah, I made up my mind this week. I was like, "There's no way. I'm not going back through that. Nope, I'm not going back through that. I'd rather just try to see with the floaters. It's not bothering me. I done got used to it now. But I'll try the natural. What you said, 30/70?
30/70.
Okay. And is that the same thing for dry eye?
No, the dry eye is the Revitalize. You'll get the Revitalize with the 30/70. When you purchase the 30/70, you'll get the Revitalize. Use the Revitalize 5 to 6 times a day for the first 2 days, and then start the 30/70 after that. You're going to want to use the Revitalize first, then the 30/70, and you're going to want to use that twice a day, morning and evening.
My husband is the one who has the dry eye. He was asking, does that work for dry eyes also?
Yes.
Yours water all the time? He said his water is all the time.
Yeah, his eyes are really dry. He's got severe dry eye.
He said it's really dry.
Yeah.
Okay, then we'll try that.
Excellent.
And I'll let you know how that works.
Don't ever, 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 ever get another one of those injections.
Okay.
Okay. You're welcome. Thanks for coming up.
All right. Thank you.
Bye.
Bye-bye.
That just makes me, it almost makes me nauseous.
Oh, it makes me angry. Because it's crazy. Basically, because she won't bend the knee to what he wants. Basically, oh well, you're just gonna lose your eyesight.
Yeah, no, and that's the
exactly.
Yeah, he's basically threatening her.
Basically. He's like, he got somebody, and I'm not calling her this. He just got somebody who was a sucker, and he kept getting it, Because did you hear how many times she said she's done it?
Yeah.
And we know how simple it is to get rid of floaters. We know that just by following you.
Yes.
Listen.
It's unbelievable. But just the thing that pisses me off even more is to lie to her and tell her that those shots are going to resolve the floaters.
Right.
That's a lie.
See, I didn't even know about the eye injections like that until my sister got her first and last. Because it only took one time, and she was like,
Yeah, I'm never doing this again.
Yeah.
Yeah, and the predominance of why the predominant diagnosis is diabetic retinopathy and macular degeneration.
Yeah. All we can do is just sit here and shake our head because it just makes no sense. I should have a pain in my neck as many times as I be shaking my head at some of the things that these doctors are telling people. People are so vulnerable. And it's just right, because our sight, that's what we have. If we don't have our sight, sometimes we can't work. We only have one pair. And we've been trying to do everything we can to save it. Crazy.
Well, and we're not told a lot about our eyes.
No.
So, it's just like almost everything else, though. We're not told a lot about these key organs in our body. So we don't know when it's good, bad, or indifferent. We're just told, trust the guy in front of you in the white coat. And in the last 30 years, we figured out time and time again, they don't know what they're doing either.
Yeah.
And then if they actually are vicious, it's worse than you can imagine.
Yeah. Oh boy. Leslie, I had multiple opinions. You get multiple opinions. But it's crazy, even when you get multiple opinions. My sister, she done got multiple opinions, and they on the same BS. Throw me your money.
Yes.
So sometimes even multiple opinions when they're in the same field, because just like on the medical side, they don't want to say anything about the other doctor because usually they know each other. So they're not going to say anything bad when they know that the other person did something incorrect.
Well, and that's why they're all in associations together.
Yep.
It's not just, I'm not just part of the American Medical Association. I'm part of the, Tampa Bay Chiropractic Association. It's national, it's local, it's regional, and it's worldwide.
Right. And they're probably also investors in the product, so of course they're going to keep pushing it.
No, 100%.
So they're going to make money coming and going. Yeah. We have a question from Shaw, period. Can the castor oil help retinal detachment? And I'm not for sure what they were trying to say, BLAME, castor oil be used? Black castor oil. Okay, they corrected that. So I'll repeat that.
Okay.
Can castor oil help retinal detachment, and can black castor oil be used?
So it depends on the severity of the detachment. It depends on the severity of the detachment. So if you have a complete detachment, you have to get the retina back in the right location and connected to the back of the eye for it to reattach. It's possible, but you're going to spend a lot of time with the head down, looking down, letting gravity pull the retina forward, and then when you're upright, you're going to want to use the eye drops. So it's a process. I would want to know what level of detachment you have and if you've had any surgery. Have you had either a gas bubble or an oil bubble placed in the eye surgically to keep the retina connected? And has that gone well? And are you getting obvious, information that the retinal attachment has occurred and is occurring reasonably well, or that it's completely reattached? So I have a customer who just a couple of weeks ago was talking to me, and he had a retinal detachment. He went and had the oil bubble put in his eye, and they told him at the follow-up appointment, oh, the retina's completely attached again. He called me the next morning. He's like, I don't know what's going on, but I can't really see. My vision is really messed up. What do you think I should do? And I'm like, I think your retina's detached again. And he's like, no, no, no. They told me it was completely reattached, completely reattached. I said, there's no way that you're reporting the thing that you're reporting and your retina is attached properly. It's not happening. I said, call, go have an appointment. Let's see. That afternoon, he was able to get in, went to the doctor. The doctor said, nope, your retina detached again. So this is a process when you have a retinal detachment or a vitreous detachment, and you can have a partial detachment or a complete detachment. So you when you go to the doctor, you need to ask them very pointed questions so they can answer what they actually see versus what they want you to know to get you to take whatever they're trying to get you to take. All right, King Sam 24K says she should just go purchase a full copy of her records, but never mention sewing. No, absolutely. She should absolutely, and I recommend everybody do that, no matter what doctor you're seeing. When you're seeing a doctor, you want to take your records, a copy of your records with you, either after the visit or have it emailed. If you have access to a portal where all your records are, all of your prescriptions, all that stuff, download it from the portal. Don't just have it on the portal, download it from the portal. Because if you lose access to the portal, you lose access to the data. That is what is going to tell anyone other than you what was actually in the doctor's mind at the time of treating you, what it was they're actively treating. Because when they put that information in a computer system to go to your insurance company, they have to classify it a certain way. And that classification, I promise you, there's no doctor anywhere, there's no ophthalmologist or optometrist that can actually classify a treatment as floater repair at $3,000 a pop. There's absolutely none. There's absolutely none. Hang on. What is the standard of care for floaters, and how can they be removed? So ChatGPT says the standard of care for managing or removing eye floaters depends on their severity, the underlying cause, and the impact on the patient's vision or quality of life. Here's an overview. So, one, observation, most common approach. Most common approach. Standard of care. In many cases, floaters are benign and don't require treatment. Patients are typically reassured that floaters are common with aging and harmless unless they are associated with other symptoms like flashes of light, a shadow in the peripheral vision, or sudden increases in floaters, which could indicate a retinal tear or detachment. Regular monitoring and follow up with an ophthalmologist are advised. Laser treatment. So there's a laser vitriolysis. Okay, when used for patients whose floaters significantly interfere with vision, the procedure is a specialized laser, YAG laser, is used to break up or to vaporize floaters in the vitreous humor. Effectiveness works best for specific types of floaters, such as large or well defined ones. Risks rare but may include increased floaters, damage to the retina, or elevated eye pressure. A vitrectomy, a surgical removal, when used in severe cases where floaters are dense, persistent, or significantly impair vision. The procedure is the vitreous humor, along with the floaters, is surgically removed and replaced with a saline solution or similar fluid. It's highly effective in removing floaters, but comes with risks. Risk of retinal detachment, cataract formation, or infection. Typically reserved for cases where vision is severely impacted and other treatments are ineffective. Addressing underlying conditions. If floaters are caused by an underlying condition, such as a PVD, a posterior vitreous detachment, retinal tear or detachment, inflammation, uveitis. Natural and lifestyle approaches. While no natural remedy can remove floaters, lie. Um, these steps can improve overall eye health. Hydration, proper hydration, antioxidant-rich diet, foods like leafy greens, carrots, and berries. Eye protection. Wearing sunglasses reduces UV damage, which may slow vitreous degeneration. And then it talks about when to seek immediate medical attention if you have a sudden onset of floaters, yada, yada, yada. But here's the deal. There's no mention of any injection that is going to solve floaters, or there's nothing known to actually break up floaters in the eye that is a prescription.
You know what the whole concept reminds me of?
What's that?
In pregnant women, when they're high risk and they want to do further study on the amniotic fluid, and they do the amniocentesis.
Yeah.
And you really have to think of the concept. They are puncturing, basically. Puncturing.
Yeah.
The sac. And it comes with so many side effects to it. One being, I think it's 1 in 100 will miscarry or have a child with some type of deformities.
Yeah.
I look at it the same way. Because you're puncturing the eye, there is going to be a blowback somewhere, some type of side effect. From punching the eye.
Yes. You can't just randomly do whatever and expect that there's no you know, are opposite effects. That the whole yin and yang of life is what it is. So for every reaction, there's an opposite reaction. That's true. That just is nature. So you can't just do something and think, oh, it's nothing's gonna be damaged, nothing's gonna happen. We're gonna give this our best shot. You know, no. It's just like the conversation we had with Robin Vanis, who was like, going to her ophthalmologist, and the ophthalmologist is like, the cataract that's in one eye is really severe, and it's so severe we're scared to actually do anything with it. So we want to take the cataract in your good eye out and do surgery there first. Are you mad? Why would I do that? That's insane. If you screw up one little thing in my good eye, I'm now blind.
Exactly.
And all you can be is sorry. You can't do nothing else but be sorry.
Right. Sorry don't cut it.
No.
And I haven't read the medical ethics on that. I know with certain medical devices, you can't even sue a doctor for it. They make you sign waivers for that.
100%.
So I can imagine it's probably the same way within that instance when it comes to injections and any type of surgical procedure of the eye. You basically saying, I won't sue you. You may make me blind, but I'm not going to sue you.
100%.
Whether it be intentional or unintentional, I'm not going to come for you.
Yeah. I'll never have any of those procedures because I will never take away my right to come for you.
Yeah.
If you need me to sign something that says I have no options, there's no way for me to recover anything in this situation. That just means you can be as sloppy as you choose.
Exactly.
There's nothing I can do. 100%.
And what makes it even worse, they come at you like a salesman. They're selling you these procedures, and then they wait until you're vulnerable, basically. And then they may give you the disclosures and all the other information that they should have gave you before they started the procedure.
Yes. And there's never any alternative measures in place. Just like, the young lady whose mother has the retinal detachment or partial retinal detachment. Did they say anything about how she should sleep, putting her head down, letting gravity be a benefit? Not a thing. Nope, doesn't look that bad. You just go home and take care. We'll see you in a couple weeks.
Right.
It's insane.
Like you said, they're waiting for her to get bad so then they can do these invasive surgeries.
Well, because the surgery is where the value is in their mind.
Yep.
And I believe there is a place for the surgeries, but it ain't every place. It's that old saying, to a hammer, everything's a nail.
Yep. Exactly.
It's ridiculous.
We're going to go back up to Shaw Period's response. She stated that no, she hasn't had any surgery. That's the thing now. Sure of the severity, she's supposed to see doctor. So she hasn't had any surgery yet. This is let's see, I'm trying to go back up. This is the one about the retinal detachment.
Okay. Well, and if the right things are done, I do believe that having surgery won't even be an option. It won't be necessary. It won't be necessary.
Exactly. Okay, we have.
Yeah, no, Shab, you're right.
Stated, what do I need for floaters, please?
3070. 3070, 100%. Norma says, I have geographic atrophy. One eye is 2200 and the other is 2080. Have you had experience with drops? So I'm just gonna chat GPT geographic atrophy. What is geographic atrophy in the eye and how can it be benefited with castor oil and DMSO? All right, this is an advanced form of dry, age-related macular degeneration. Got it. That causes progressive degeneration of the retina, particularly in the macula, the central part of the retina responsible for sharp vision. It's characterized by the loss of retinal pigment, epithelium cells, and photoreceptors, leading to patches of vision loss. So, the question that I have, Norma, is how severe is your situation right now? What are you experiencing as far as your eyesight is concerned? So, and the causes are oxidative stress, inflammation in the retina, accumulation of drusen, so lipid deposits. Do you have a lot of drusen? I'd want to know about that. Um, Gradual loss of central vision. Are you dealing with only periphery vision or pinhole vision? Difficulty reading, recognizing faces, and performing detailed tasks. Peripheral vision typically remains intact. Okay, so you're not dealing with pinhole vision. GA develops slowly but can lead to severe vision impairment over time. Potential benefits of castor oil with DMSO. Castor oil and dimethyl sulfoxide are not conventionally used to treat GA, but their properties may offer some complementary benefits when combined. These claims are largely anecdotal and lack rigorous clinical studies, so they should be approached cautiously. So, antioxidant properties rich in ricinoleic acid, castor oil has anti inflammatory and antioxidant effects, which may help reduce oxidative stress in the retina. Hydration, castor oil can improve hydration in the eye's surface and may support overall eye health by reducing dryness and irritation. Support for RPE cells. While unproven, castor oil may theoretically support RPE cells by nourishing the ocular tissue. DMSO is anti-inflammatory. It has anti-inflammatory action. So DMSO can penetrate tissues deeply, potentially reducing inflammation in the retina. Antioxidant effects, DMSO scavenges free radicals, which could help mitigate oxidative stress, contributing to GA progression. Drug carrier, DMSO enhances the penetration of substances into cells, potentially adding the delivery of beneficial compounds. So I would say that yes, there could be a lot of benefit in this situation. I would recommend that you would use the 4-in-1 and the 40/60. Um, I'd have to give you a personal protocol because I want to see every 7 days how your eyes are changing and shifting, and how the eye health is increasing over a short period of time. I would imagine that in 30 days that you would have a significant change in your eye health and your eyesight. And then we would want to go there. We would want to continue forward to make sure that the changes in your eyes are going to be static. So they're going to be consistent and they're going to be stabilized. So that's what I got for you.
Norma said yes, lost the central vision, and she's also been taking shots.
Okay. Yeah, I would want you to stop the shots almost immediately. And we'd have to talk. We obviously have to talk, so take down my number. But there are definite benefits in using the eye drops, the natural eye drops with DMSO and castor oil. All right, I'm past my time. It's 11:21. That's fabulous. And I obviously didn't call for any tap parties because we only got, what is that, 8,600
Yeah,
likes?
I did a couple of them, but it wasn't enough for us to reach our goal. But that's okay. We'll be back tomorrow.
100%, 100%. I appreciate all 46 of you for being in the room and hanging out. I appreciate it a lot. King Sam.
And Norma, she asked about your contact information. It's actually right above her head, along with the website to place an order. And that
100%.
is her direct number.
King Sam 24K. Always sign every. Oh, I think you're saying sign. Always sign every contract. UCC 1308. All rights reserved above or below your signature. 100%. 100%. Hey, Sheldon, thank you for the rose. Thank you for the rose. Norma, I hope you got my phone number. Everybody, thank you so much for hanging out. Coco, thank you for all your help. Give me a call tomorrow when you have some free time. Let's chat. And I love you all. I love you all. I love you all. Have a great night. I will be back tomorrow, which I believe is Friday.
No.
What? Tomorrow's Thursday.
Yes.
I'm pushing the week. So I'll definitely be back tomorrow then. Definitely be back tomorrow, 8:30 p.m. Eastern time. Thanks so much, everybody, for hanging out. Love you all. Have a great evening. I feel like I'm falling asleep sitting here on the couch.
Oh, no, ma'am. Go to bed.
All right.
See you tomorrow.
Bye.
Bye.
All right, Doug, if you're still there, thank you so much for hanging out. Oh, there's somebody else. So thank you so much for hanging out. YouTube, I am out for the evening. I'll be back tomorrow, 8:30 p.m. Don't forget to like, share, and you obviously commented. Yay. Good night.